For example, if introverts, they know what is going on in their mind more than the extroverts. So similarly, the autistic kids, they are more driven, they have less identity, they have identity crisis also, then they sometimes don't identify their parents also, they have a lot of sensory issues. So all these issues are very easily there, it's addressed by the music, different kinds of music, and we use a lot of musical tools with them. So the first and foremost thing, what is most has been very researched and effective field in which music therapy has been evolved a lot is ADHD and autism spectrum disorder, that is the ASD. So it started even in the Western field also. It started with autism. Why? Because autism is a spectrum which basically in autism we have the kids who are sometimes they are very cognitively disabled, sometimes social and communicative disorders are there. So it's a very big spectrum. The child can be very intelligent, but they can have the aggression disorder. He can have he is very social and communicative, but he is having some cerebral palsy or some intellectual disorder or motor skills disorder. So autism actually is a very big spectrum. In fact, they are able to research much, but still there's a lot of left in autism. But one thing is very common in autism, that their right hand side brain hemisphere is very active in listening. The analytical brain, that the left hemisphere might not be very active, means they are not very good at academics or the motor skills, but they are very good in finding music, and that sense of musicality is very it's tremendous in the autistic kids. So this is one thing, and this is a research that why it is so, because they are very creative. Their creative side is very active. Obviously, because there is one reason is that they are not very. They normally are into their shells. They are not very social, communicative. So when they are into the shell, so what all brains, they are very inward driven. They are introverts. So when they are introverts, then when you are inward driven, you normally you are able to watch or listen to your own sounds. For example, if introverts, they know what is going on in their mind more than the extroverts. So similarly, the autistic kids, they are more driven, they have less identity, they have identity crisis also, then they sometimes don't identify their parents also, they have a lot of sensory issues. So all these issues are very easily there, it's addressed by the music, different kinds of music, and we use a lot of musical tools with them. Second is schizophrenia, ADHD, schizophrenia. These are also mental diseases which are mainly for the kids. So we normally train the kids for a certain musical tools. So schizophrenia, cerebral palsy, then ADHD, then we have speech disability, the kids which have problem with the social and communication disorder and the speech disability. Like if they have a tongue tie, so we use some kind of Sanskrit mantras and the rhythmic tools. Rhythmic tools are very effective for the kids who are not very well versed in the speech, or they're having some kind of speech disorders. So these are for kids. Now we go to the adults. Then we have a lot of researches, and we have got a lot of case studies also, that how stress and anxiety is getting managed through music therapy. And it's very important for the patient or some people with higher stress and anxiety, when they listen to a certain kind of music at a certain time. Similarly, insomnia, oh, we have a very tremendous results that how insomnia is getting improved. Insomnia is the one of the sleep disorder. Now, sleep disorder means when a person is fully awake at night or he's sleeping too much. That is, these are sleep disorders. Or a person is not sleeping according to the body clock, but he's sleeping throughout the day. So, insomnia is something which makes a person follow their body. So, music therapy, when they go with the music therapy, they follow their body clock. So, these are certain diseases which are actually getting worked, and through our researches, and we have a lot of team of music therapists, they are working on the that music, how music therapy treats the people with drug addiction. We have a lab in Punjab, and they are treating with the drug addiction as well. Then we have Alzheimer, Parkinson. All these brain disorders are getting treated through music therapy, and we have a lot of researches in that as well. But the same thing, maybe in Alzheimer, we don't have the researches, because the moment they get Alzheimer, first of all, it takes very less time for them to reach to the higher stages. And secondly, the medicines are there. And we can't have people not to have the medicine, because it's reaching high on the high and chronic stage. Depression, MDD, major depression disorder, is something which is which we use music therapy, and it's much effective. OCD is something that it's very common among the youngsters, but it's very effective. Music therapy tools are very effective for OCD as well. So we have a lot of right now, whatever I have listed out is mainly brain disorder or the mental disorders. So right now, whatever researches we have or case studies what we have as a music therapist, normally we feel that we have a very good hands in the diseases which are mentally originated.